Thank you for watching this short video explaining our research project on appendicitis. The purpose of our research is to see if we can treat children with appendicitis without an operation. The study is taking place at several specialist children's hospitals across the country and has been carefully designed to make sure it is safe for all children taking part. The study is funded by the National Institute for Health Research, which is the research arm of the NHS. Here's what being in the study involves.
Your child has been diagnosed with appendicitis. This means that the appendix has become infected and sore. Up until now, the standard treatment for appendicitis has been an operation under a general anaesthetic to remove the appendix. But recently, other research has shown that most children with appendicitis can be treated with antibiotics instead of surgery. Many parents don't like the idea of their child having a general anaesthetic and surgery if there is an alternative that works. In our study, some children will have surgery and some will have antibiotics instead. The treatment your child receives will be chosen at random. Every child will have an equal chance of having antibiotics or surgery. Either way, your child will need to spend a few days in hospital, will receive painkillers, and will be closely monitored to make sure they are getting better. Children receiving just antibiotics will be given antibiotics through a drip for at least 24 hours and will be able to eat and drink as soon as they feel well enough. They will be closely observed, and once doctors are happy your child is getting better, they will be allowed to go home. Before leaving hospital, you will be given antibiotic medicine, which your child will take by mouth for about a week. If, at any stage, your doctors are not happy that the antibiotics are working, then you will be offered surgery instead. Children receiving surgery will need to wait for a space in the operating theatre, and then will have surgery while they are asleep under a general anaesthetic. Surgery is done through one or more small incisions and takes about an hour. Your child won't be allowed to eat or drink until they have recovered from the surgery. When your child is well enough to get out of bed, you will be allowed home. After discharge from hospital, you will be given a phone number of who to contact if you have concerns about your child's recovery. For all children, regardless of whether they have antibiotics or surgery, there are no specific restrictions on what they can eat or on their activity. Everyone will be reviewed in the outpatient clinic at 6 weeks and then by phone or video call at 4, 8 and 12 months so we can check on their progress. All of the information about your child's participation in the study will be kept confidential to the research team.
I want to reassure you that being part of the study poses no additional risk. I also want to explain that you don't have to take part. It's entirely voluntary, and your care will not be affected in any way if you don't wish to take part in the study. But by saying yes, you'll be helping us to find out the best way to treat children with appendicitis. And this knowledge may in the future mean that families like you have a choice as how their child is treated. That's how we use research to improve the care of our young patients. The research team will now speak to you more about the study and answer any questions you may have.